Welcome to Raaonline. I'm Dr. Anita. I'm a consultant microbiologist. Today, I'm going to discuss about healthcare associated infections. To start with definition, so what is healthcare associated infection? So it was previously called as hospital acquired infections or nosocomial infections. It can be defined as the infections acquired by the patient admitted for a reason other than that infection not present or incubating at the time of admission, and symptoms appear at least after 48 hours of admission, and include infections acquired in the hospital but appears after discharge. It includes occupational infections among staff of healthcare facility. It was estimated that about 5 to 10% of patients admitted to acute care hospitals develop hospital acquired infection, which is called healthcare associated infections. So the factors affecting hospital acquired infections. The first is immune status of the patient. The patient admitted in the hospital or immunocompromised as a result of pre-existing disease or maybe the treatment received in the hospital. The second one is hospital environment. The hospital environment harbors a greater magnitude of microorganisms, and most of the bugs sitting in the hospital environment are multi-drug resistant. So this may be due to the increased usage of antibiotics in hospitals, and initially the resistant bugs which are present in minor population flourish due to constant antibiotic pressure. It slowly replaces the susceptible strains. And third one is diagnostic and therapeutic interventions. Patient undergoing interventions like IV catheter insertion, urinary catheter insertion, ET tube insertion are more susceptible to develop hospital acquired infections, and the products, blood and blood products which is being transfused to the patient which is not properly screened may result in hospital acquired infections. So bloodborne infections like HIV, hepatitis C and hepatitis B, and HIV and hepatitis C virus infection. Finally, the hospital setting. So the hospital setting should be spacious and well ventilated, and cleanliness should be maintained in the hospital atmosphere in order to prevent the spread of hospital acquired infections. So moving on to the sources. So what are the sources of hospital acquired infection or healthcare associated infection? So the sources are classified as endogenous source and exogenous source. So endogenous source involves a patient's own microbial flora that may invade the patient's body during some surgery or instrumentation, whereas exogenous sources are from the external environment, healthcare workers and other patients. Environmental sources include inanimate objects, bedpans and medical equipments, whatever the instruments we are using during patient care are the primary sources of healthcare associated infection. And of course, the healthcare workers are the potential carriers of multi-drug resistant bug. Example, MRSA, that is methicillin resistant staphylococcus aureus, nasal carriers of MRSA. And of course, the patients who are admitted in the hospital for other illness are also the potential sources of healthcare associated infections. Moving on to the causative agents. So the pathogens which are more likely to cause healthcare associated infections are categorized as escape pathogens, that is Enterococcus faecium, Staphylococcus aureus, Klebsiella pneumoniae, Acinetobacter baumannii, Pseudomonas aeruginosa, Enterobacter species. And other infections caused in hospital environment are caused by E. coli, Mycobacterium tuberculosis, infection caused by Candida species and Clostridium difficile. And also bloodborne infections are transmitted through contaminated needle prick and contaminated blood and body fluid exposure. So what is HAI, healthcare associated infection? So healthcare associated infection are a result of germs entering our body during medical care. So what are the types of healthcare associated infection? The four most common healthcare associated infections are urinary tract infection, that is especially catheter associated urinary tract infection, surgical site infections, bloodstream infections and pneumonia. Catheter associated urinary tract infections when the germs travel along a urinary catheter and causes an infection in your bladder or kidney. Whereas surgical site infection is an infection that occurs after surgery in the part of the body where the surgery took place. Bloodstream infections when germs enter the blood by way of a catheter or tube that is placed in your vein. Pneumonia is infection of the lungs. So types of HAI, as I told before, UTI, that is urinary tract infection, pneumonia, surgical site infection and bloodstream infections. So UTI accounts for the majority of HAI, that is healthcare associated infection, and risk factors include advanced age and female gender, severe underlying disease and placement of catheter. And most common bugs causing UTI are gram-negative bacilli, which is Escherichia coli, followed by gram-positive bacteria and Candida species. Pneumonia, this infection of the lungs. Risk factors include advanced age, chronic lung disease, aspiration of upper respiratory tract secretions, semi-conscious patient, mechanical ventilation and chest surgeries. And most common agent causing pneumonia are gram-negative bacilli like Klebsiella pneumoniae and Escherichia coli, and followed by gram-positive organisms like Staphylococcus aureus.